Okay, hello everybody, and this is Greg and Larry.
Welcome back.
And we're going to continue our conversation on on-site services. Just to reiterate, if anybody has any questions or comments, please throw them our way and share with the group. I'd like to get everybody else's perception on this too. So just kind of an overview, first of all, of what we talked about, addressed last week, was the different on-site services. And things that we talked about, included the early intervention, early injury, the benefits of that. Larry talked about the process of what he's doing on site and how that can go a long way in managing these musculoskeletal injuries that we're trying to prevent. The physical demand assessment, multiple names, essential job function analysis, whereby looking at the physical demands of the job and then ideally bringing that into the clinic if necessary, matching up what the person has to do with what they can do. There's benefit, obviously, to that. So just the different names, that's one of the points we talked about, is that going on site, these employers are going to have different names for all of these, and really just knowing what it is that they want to get out of it, regardless of what they call it. Combined with that, oftentimes, is looking at, from an ergonomic standpoint, analyzing the risks associated with the job, what risks are inherent in how the job is structured, as well as how that person is performing the job that would increase the probability or risk of musculoskeletal problems, and how we could not only identify it, but interact to minimize those risks. So that brings us to the job coaching we're going to talk about, and very much related to that is the whole employee education. There's some subtle differences there that we'll talk about, but again, this is working with the employee at their work site, talking through, it's kind of a problem-solving process. Employee education may be more of a group sort of setting. And then the warm-up stretching programs that employers oftentimes or may want as part of their package or process of addressing these problems. So we're going to talk about today, finish up talking about the job coaching, employee education, and warm-up in terms of on-site services. And then we'll finish it up, I think, with a little bit more talk about the recordable and non-recordable issues that we touched on last time, but emphasizing some of the specific points so that when you're on site, what to do, what not to do, what to document and not. We'll talk a little bit about the tools that are needed, excuse me. And then I think the last thing will be just what are some of the contractual things that we might, when we're talking about working with an employer, establishing services, what are taking into consideration there. And certainly when Ken's out there talking with employers and arranging contracts and working on agreements with them, what are some of the things? So we'll finish up with that. The treatment side of it, we're not going to get into a whole lot, but just realize I put that in there because there may be situations, again, where we're performing physical therapy services on site. It's not going to be real common just because most of these situations will be with larger employers. It could happen and we have those situations, but that's really kind of another talk. But realizing that providing certain treatment on site lends itself to doing all of these on-site services that we're talking about other than the treatment. So job coaching, what is it? When's it used? And basically, it's working with the employer, interacting with them at their workstation. It's going on site with them, going to their work site, their workstation, and problem solving and say, what are your problems? This is what the job is, and then really identifying what is it that they're doing. Are there ergonomic issues or performance issues that contributes to the complaints that they might be having? So it's identifying those tasks that can contribute to the musculoskeletal problem. So it's a one-on-one situation. So you're training worker and performance and how to reduce the risk. As we mentioned before in the ergonomic talk last week, is the job may be set up well ergonomically, meaning everything is positioned properly and it's designed so that it can be performed in a good way. But that doesn't mean that the employee is doing it that way. And so it's working with them, watching them, observing them, having a conversation with them as to why they do it this way, thought about doing it another way. So it's a real effective way of solving the problems, identifying the risks, and it's really a process where it may take more than one time to spend. It may take repetition, because if it's a performance issue, it's how they're doing the job. They're used to doing it that way, and sometimes can be very challenging if you've got somebody who's been doing it for 20 years and you're telling them how to do it differently. It takes some nuance, it takes some skill in order to get their buy-in. So you've got all of that to go into it. But it's a real effective way, and I think it's oftentimes it's something that's not utilized enough. We can talk about how they should do things, but until they're actually experiencing it at their job, that's certainly where we can add a great deal of value of being in the plant on site there and working with them. So a lot of it comes to them being comfortable with whoever is on site, so they can trust you. So it's building that relationship with them so that they'll take you seriously and help them with that. So I want to talk a little bit about employee education, because, as I said earlier, it's very similar. When you're job coaching somebody, you're educating them. But often, there are times too when an employer may want a bigger or a more group type of education process. I run into these where, as part of their safety orientation or their safety education, they'll want somebody to come in and do a presentation. They've how to lift properly, or pick your topic. So it may just be that one-off sort of group presentation, but it goes along with that job coaching if you're looking at movement patterns, performance of the job task. So it's really intertwined and very much related. But I separated them out mainly just because of that potential group situation where the employer may ask to come in and do some educational training. So you're looking at these type of things, tool, equipment, and replacement, but also the education part of it, along with job coaching, education, not only looking at how are they doing their job, but if they have an issue, it's your opportunity to talk to them about what is expected, what is normal, what's abnormal, what's expected and normal in terms of a healing process. So it's a way of educating them about, okay, this is normal or it's not, because we have to remember that these people oftentimes don't have the experience. This may be the first injury. They don't know what to expect. So you get into that, fear issue. You get into that, what is pain versus a harmful situation. And it's very helpful educationally for them to know, okay, this is normal. And that goes a long way in preventing the disabilities associated with these musculoskeletal problems. So. And yeah, again, I pointed that out before. So, so now Larry's going to talk about, okay, where does this come into play? What are some of the experiences he's had and what he's been doing? And talk about certainly the documentation piece of that as well. So I'll turn it over to Larry.
One of the things, if any of you know me well, this is kind of my favorite part of the on-site service. I like to talk, I like to educate, but I don't like to do a lot of documentation. Just a little bit of documentation goes a long way. So this is right up my alley. I don't have a set time of how much information I can give. You might be on site for 4 hours, 2 hours, whatever, and you can just really fill out the employee, the safety, and really help them understand what you need to look at. So the large percentage of what I do on site would be classified under employee education and job coaching. And it just kind of goes right hand in hand with the PDAs as well as the risk assessments. As I indicated last time, both these can be categorized. That employee education, I would, we try, if you want to categorize it, it kind of goes under the health interaction part of it. Once you start to define, is there first aid? What is the, is it a physical therapy type of thing? Does it need to be going to a doctor? I just recently, this early in the week or last week, at Case New Holland, Burlington, they had a gal that had a rotator cuff repair, they bring them on site day one, or day two, right after surgery. They're on site all day. So they don't let them go home and rest. They have nice chairs and recliners. So, she's getting therapy, but she's coming into work. She's there 8 hours a day. And so, they get the post-op report, and she has no clue of what that is and what the necessarily, or she doesn't understand it and the rehab protocol. So you're just educating them on what does that mean and what is that protocol. So you can certainly do that on site. And then, as they get better, helping them understand, if they sprain their ankle, some of these employees have never been hurt before, and a sprained ankle is the worst thing that ever happened to them. And boy, it's turning a little black and blue. It must be something really bad. So if you start to explain them what that expectation is, it's going to get swollen. It's going to look a little bit of black and blue. You really need to kind of put a little weight on it or not. They really appreciate that. And, if you can explain that over what's happening in that next day, next week, it really is helpful. And they're more appreciative of when it does happen and not so scared. So from an employee education, there's just lots of things that you educate them, and you just feel them out. A lot of times what you do in physical therapy in the clinic, when you get into the difference when you're trying to educate somebody in terms of what to do and what to not to do on their job, it's really difficult trying to spend some time and really navigate through their answers and what do they really do on the job. And so how much do they lift and how do they lift, and what kind of tools they use? Is it a pistol grip? Is it is it really low? Is it really high? And so being on site, you get to see it. You really get to see it, and as therapists, we know what angles are right. Ulnar deviation and wrist flexion and shoulder abduction, and you see, boy, how those things play a factor in it. And then you could really go out to their workstation, as Greg, and make those modifications, and really, it really makes sense to them. Some of these employees, they don't know how to think outside the box. You can tell them, but they don't know how to make the changes. This is the way I've been trained, and this is the way I have to do this. And so you really have to kind of coach them along and help them understand. So, that job coaching, again, like we talked about, falls under that safety interaction portion of it. What kind of safety interaction do we have? And at job coaching, you start to recognize this person can't do something, or then it can progress into the job modification, the retraining, and even restructuring part of the job. So, you're able to work right away with the supervisors and help them understand. You're able to work with the safety department right there and the nursing and say, we don't want to necessarily go in and say, you can't do this job. Okay. And that's not our role, is to say, don't do this job. You absolutely need to go home, or absolutely can't do this. Our role is to educate and provide information and let the employer make that decision, because we don't want to put in a situation where if you tell them they can't do something, and it's just a simple job, it can lead into a recordable type of injury. And we'll get into this a little bit. If you tell them they can't do the job, that would fall under something that we can quantify as a recordable injury, and we'll get into that a little bit later. So it really works well. you know, even from a standpoint of, as therapists, you're thinking, you know, how do I want to go out, you know, I want to go out and look at the job. I mean, not everybody, every one of you are going to have a company that you're going to go to and treat them twice a week, 2 hours a day, and really get a feel for the job. Some of you just say, you know, I really want to know what this job is so I can treat and be a better clinician and really treat this. And if I'm not taking care of the aggravating factors, I'm just spinning my wheels. I'm making some progress. But so by you being able to know what types of job coaching, you can call up the supervisor, you can call up the employer and say, go on site and really look at it. And that might be one time. You might do, that's how I got started. I just called them up and I said, can I look at the job? And then you get a chance to job coach a little bit and educate them. And then you really get a better feeling for the job. And then you see it the next time. So it doesn't have to be a full-fledged on-site company. It could be a company here, a company there, because it's part of something that you're trying to make this patient better, make this employee better. And then sometimes it leads into something a little bit more down the road. You know, it's really recognizing the poor habits. You know, I see a lot of poor habits on the job, you know, that don't have to be done that way. And you just ask them, well, why is that being done that way? It's either because that's the way they've been trained, and maybe they're fifth generation trained. I mean, and what that basically means is this person trained this person and this person, and pretty soon it looks nothing like it's supposed to be. And so you have to dig back into the start of that. And again, it goes back into communication with the supervisors, employer, the nurses. Everybody involved is right there on site. Everybody you can make a decision and make changes right away. And it doesn't have to be big changes, but it can be a little bit of little changes. So, you know, we're seeing that at Case New Holland. We're seeing that at Hahn. Going back into the education part of it, you know, I've been doing some presentations for their safety department at Hahn, and we got to a point to we were talking about risk factors, and we talked about you know, footwear and stepping and what they're wearing, and it led to them basically saying, hey, we want you to do a 2-minute video, like a TED Talk video, just outlining what it looks like what proper shoes and footwear and things like that. So when these people, when our employees, the shoe truck comes along, that they could run this video that entire week prior to them getting new shoes, and they have a general idea. So that falls into that group education, you know, and that part, you know, and we have plenty of resources. I can't say I'm the most expert. We obviously got plenty of people in the company that will help me along with that, but it's just a simple video, and then we can pass it along, and we have that resources as well. So there's a lot of, and then, you know, so it helps you understand what safety interactions that we're going to incorporate by just being on site. When it comes to the documentation part of it, we're not doing a whole SOAP note. Okay, we're just documenting the interaction. You know, what do they say? Yeah, there's some subjective. What workstation did you go? What department were they in? You know, what did the employees say is they're having most difficulties with? You're documenting, who did I talk to? Who did I share that information with? I talked to them so basically I saw John Doe on, he was having some shoulder problems, identified that all his tools were put up at 72 inches because they're and so he had to reach there. I talked to him about potentially bringing that down. I talked to safety that was an issue. You know, so we're documenting who we discussed that with. Just a paragraph form, just a basic information. So it's not lengthy. It's just something you can reference, something that you, and then you can follow up with that the next time. And the next time you go on site and say, hey, how'd you do with those interactions or those changes we recommended? And they tell you, I tried that, it didn't work, or yeah, it worked well, I'm still working on it. And those simple things that, hey, I talked to John Doe today, he said he tried to do some of those exercises, he tried to make those modifications, felt like it was a little bit better, you know, we're going to follow up next week. And that's all it can be. So when we're dealing with the job coaching and employee interaction, or I'm sorry, the job education. It's brief. It's not a full-fledged. It's not a physical therapy. It's an appointment. Okay, we need, and we'll get into this a little later about knowing that we don't want to use big terminology for this that would look like that we're doing some type of physical therapy treatment or medical treatment, just education. Okay.
I think we'll pause here for just a minute and invite anybody having questions, comments about this or anything we've talked about previously.
We have you muted at this time. If you wouldn't mind typing in your chat box for questions. Sometimes we get a little bit of background noise when we unmute everybody. So if you could just type in the chat box, we'll read them out.
All right, we will press on then. There are times when an employer will call and say, hey, can you show me a stretching program? Not uncommon. And oftentimes it's part of their overall initiatives or in addition to other things that they're doing to prevent musculoskeletal problems. So that's certainly something that we can provide. Just in a couple of minutes to talk about that. Usually this is in a group setting and they usually do it at the beginning of the shift. So developing a series of exercises that are designed based on what their jobs entail. We think industrial here, but we've also done them for office settings. If you think about it from an office perspective, people that are sitting a lot. So you are typing using mouse, upper extremity, back. So the exercises that you're showing them will be different, certainly than an industrial situation. So there's some evaluation or assessment of what the job demands are and structuring them, the exercises. But it's typically part of a group. They have somebody to lead it, beginning of the shift. And the benefits have been shown. There have been some studies over the years that have demonstrated the benefit of this if administered over a long enough period of time. And oftentimes, like I said, it's often part, it's not the only piece that they incorporate into their efforts to decrease these problems, but so it has been shown to be beneficial. So there's evidence out there. And the key to it, we found, is that the support from all management. The trials that you have with this is you have a group of people potentially that aren't familiar with exercise, not interested in exercising, and it's difficult to sell them on this concept. And we have done some in the past and learned the hard way by going in and just showing people exercises, and it goes nowhere. If it doesn't have the support of management all the way down, because they're the ones that have to keep doing this, and selling it and promoting it, talking about the benefits of it, because you're changing habits, you're changing the habit of not doing this to doing something physical that they may not be too thrilled about doing. But over time, if they can maintain the momentum, it can be very effective. So that's really important. And I know Larry's kind of in the process right now of working with Carver Pump, I believe, is the most recent one. But we've done them several others, and many of you may have had the same situation. So I'm going to let Larry talk a little bit more about some specifics.
So implemented stretching programs, and stretching sometimes nowadays gets a bad rap. They just think they're going to go stretch, and they're like anything else, you can call it anything. I tend to throw in there a work readiness program. It's got a little different title, a little different ring to it, and it's just preparing them from work. Okay, and so it's not all just stretching. I mean, there's some dynamic warm-ups, there's some static stretching involved with it. So you really just have to feel out. And so what goes into designing the program? Well, there's some specific things that questions that you really have to ask. And certainly, we don't have this in the PowerPoint, but I could put this in at a later date, is you really have to ask, how much time do you have? How much time, because we all know exercise. There's hundreds and hundreds of exercises, and you can show a 30-minute routine, and they're just not going to do it. So typically, most companies will have a pre-work meeting or something like that, and you got about 5 minutes on average, 5 minutes to show a stretching routine or a work readiness routine. Okay, so that's not much, but you want to try to hit as much stuff as you can. So you're going to have to tailor your hold times and your repetitions a little bit. And with the main goal of that is, how much are you going to get in a 5-minute routine? How ready are you truly going to get in a 5-minute routine prior to work? Okay, maybe a little bit. Okay, but what you're hoping for is that you teach them how to stretch properly, or do things properly. Teach them what the exercises are designed to. So when they're working and they're doing, they start to have neck problems, they can go right to that stretch and do it periodically throughout the day. So while it's a pre-stretch routine, I always make sure I tell them, you should be able to do these throughout the day. And then I tell the supervisor, I say, now that's the first go-to question you should have when somebody has a complaint. Somebody has a neck problem. Okay, are you doing your stretches? Are you doing them correctly? Are you holding it too long? Are you being too aggressive with it? Okay, if they can't reproduce it, they're not doing it anyways. So it's a good thing for the supervisors to really say, are you doing them correctly? So, and then if they are, are you doing them throughout the day? Well, no, I just do them at the beginning. Well, try starting to do it a little bit more throughout the day. When you're in that position for a period of time, start using this. So 5 minutes at the very beginning of the day is, if that's all you got, 10 minutes, then you're going to design your time frame around that. Okay. When are you going to be performing it? Most of it's pre-shift right at the beginning, but some companies like Han, they'll do them right before or right after their break and right before they start it again. So they might get it 3 times a day. Or are they going to do it at the very end of the day? Are they going to do post-stretching? So sometimes they can do that there. And I always tell them, I said, at the end of the day, what do you do at the end of the day? Are you bouncing around, going to the gym right off the bat, or you just slouch and get on your phone and you slouch, sit in your car and go for a 40-minute drive home and go home and sit and reach? So they're really just cooling down and getting tight anyway. So encourage them to, hey, it's still pretty important to do it post work as well. What kind of space do you have? Are you doing in this tight space, or is it a big area? Are you gonna, is there space to move around? Because if it's in a tight area, you're not going to be able to do large arm circles and things like that. But if you have a big enough space and it's important, then that's going to be important. What kind of props do you have? And what I mean by props is, sometimes, believe it or not, some of these people don't have good balance, right? Some of these older population, and so they need if you're going to give them a stretch that they need to be on one leg, they're going to fall over. So if they don't have anything to hang on to, or, if they have a wall that they can, reach their arm and do a stretch, you can show them that. But most of the time it's just a big open area. So you can't show them stretches that they need props. They need a stick, they need a wall to stretch their calves, to lean on. You can't, so design that based on is it an open area? Do they have things, props that they can? Most likely they don't. If you're trying to stretch it back and you want to put your foot up on something, a box or a chair, that may not be available. Employee age demographics, right? A lot of these older places, they don't have good balance. They're not flexible. They're going to have some stenotic backs, and so you got to be a little bit less aggressive initially. So if you have a larger older population and you have some younger population, you really have to start out basic, because you don't want to create more injuries, okay? And you don't want to be overly aggressive. So if that age of that population is older, you're probably not going to do a lot of aggressive back bends and deep knee squats and things like that. So you have to tailor that. Certainly with Case New Holland and Carver Pump, there are areas that they're, they got a lot of joint limitations, so we just have to be able to recognize that. What areas do you want to target more? So we tend to target, if it's in an assembly factor, it's, a lot of companies are doing a great job now moving things up off the floor so you don't have to bend and lift off the floor. But the problem with that now is it creates a lot more upper extremity problems, a lot more reaching. So they got a lot more wrist and elbow and shoulder problems. So maybe you're going to put a little bit more of the exercises into that, the upper extremity, a few more of those than you are with your calves or your back. Okay, so knowing what areas you want to target, and then we talk about static versus dynamic. Okay, and I throw a little bit of both. I throw a few exercises of dynamics just to get the blood flowing, but then mostly it's static. And with the static, if you're going to give them 10 exercises, you're not going to be able to have them hold it for a minute or hold it for 30 seconds. Okay, you're only going to be able to maybe get them to hold it for 5 seconds and going different directions. So but again, you educate them on, okay, what let's do. You can hold it longer when you're doing this on your own, but for the purpose of the pre-stretch routine, this is the length. Let's just focus on, can you do it correctly? And then who's going to lead the exercises? Is it going to be us as therapists, or is it going to be the supervisor? Is it going to be a group lead? Is it going to be a member or an employee? Most of the time it's supervisors. So you really have to educate them on how to correct people. And then if they don't know how to correct them, then they need to know when something doesn't look right, then they need to send them to us as therapists. So, you need to know who's going to lead that. And a lot of times what this will lead is we're going to give a basic exercise. We're going to give a basic exercise and we're going to promote it. We're going to say, try this, get used to it, get used to movement. Okay. Don't feel like you have to get the maximum stretch out of it. You're going to have some people that buy in and some people don't. Some people are going to be over aggressive and they're going to have symptoms, and some people are going to, be under aggressive. What we hope to do and what we're going to do with Case New Holland is we're going to do what's called lunch and learns. After we get this rolling out for a couple months or a few months, there are going to be people that want to buy into things. Okay. And so we're going to do a lunch and learn. We're going to come in at 30 minutes at lunch, and those that want more, we're going to show them some band exercises. Okay. As a group, we're going to show them some more, maybe some dynamic warm-ups, and leave that open for a little bit of education on, on things like that. So, it can graduate into a little bit more stuff with that. So those are the type of things with Carver Pump. We're just starting some of the same type of things that we're doing. They're designated, but they're going to not only do at the very beginning, but they're going to do midday, and they're also going to do post day. And they don't have as many employees. They have 55 employees, and it's getting them to buy in to doing this stuff. So we're starting that up here. We started a little bit this week, and we're going to be starting that up, and next week a little bit more full-fledged, getting it rolled out to the employees. But you'll get people that just sit back there and just go through the motions and are doing it. You're not going to get everybody, but those are the type of things that we're doing, and that's what it takes to really design a program, a stretching program, the thoughts that go into, and what questions you need to ask before you just, because every one of you have good knowledge on exercises and stuff, but you're not, it's just very difficult to meet the needs of them, and your exercises could be an hour long, and they could be great exercises, but sometimes you have to do the minimum. So
yeah, and the education, we keep repeating that, is a big part of it. I always try to convince the employers when we're talking about this is to allow us the first to talk about why we're doing this to the employees, as opposed to just saying, here, do these. Hopefully that makes a difference. It makes sense to me that giving them a little bit of the why we're doing it is helpful.
And I add to that is what I found has been most helpful education wise is once you start to identify what are their highest risk of it, what injuries do they sustain the most, what do they see most, what is, it's a rotator cuff, is it carpal tunnel. If when you're showing those exercises and you're throwing out that terminology, this helps that joint, this is going to help with the rotator cuff. Then they start to peak up. The management starts to peak up, and they start to realize, okay, this could be helpful. And then they can pass it. Again, it's not going to solve the problem, but it can help with that.
So again, any questions, please type those in. Otherwise, that kind of concludes the services that we thought that would be most likely, or the ones that we feel that we're going to be involved with. And again, the whole point here is that it can go in a lot of different directions. They're intermixed. They certainly can be provided as an agreement on an ongoing basis. They're also any time in the clinic that you have the opportunity to go out and invite yourself. That is an excellent way to get yourself out there and to establish a relationship with the employer. You have somebody in your clinic to take a look, and you may be involved to some degree with any of these services or all of them. It depends on the situation.
And I'll just a brief note is, again, any one of you that again, if you have a patient, if you have somebody that, boy, you'd really like to be able to see that job, see what they're doing, how can I have an impact? But you don't, you'd like to go out to the job and see the employer. Call us up, myself. I'd be happy to set up an arrangement if we can get a hold of HR, safety, and say, hey, can we come out and look at we're seeing such patient for you. We'd really like that we see if we can identify the job and what they're doing. And I think it'll really help in their recovery once we identify that. I'd be happy to block some time out, go to that employer with you, and give you a better feel for that. So I think that's, and a lot of times with that just leads into more services. They'd see that what we're doing, and we can identify that, it can lead to a job analysis. It could lead to more care, more therapists, them calling you for advice, and then it can lead into, again, show us a stretching routine. Again, Greg will tell you, this is kind of how we got started. We started doing stuff like this, and it just led into one thing after another. But feel free to call us and call me and say, I'd really like to see this job, and we'll walk you through how do we do that.
Okay. Wanted to talk a little bit more in depth about the recordable, non-recordable issue. We alluded to a little bit last week, but a little bit more explanation I think is helpful because it can be a significantly important thing. So the issue of OSHA recordability, OSHA, Occupational Safety and Health Administration. If it's an OSHA recordable, there's a process where certain industries are required to document every injury that they have. So we want to talk about what constitutes a recordable, what doesn't, where the fine line is, and certainly how would that impact us if we are on site in a capacity. The fact that employers have to submit an OSHA, you may have heard of an OSHA 300 log sheet. It's, again, additional paperwork that has to be submitted to tracking these certain types of injuries. And also employers realize that, and I think Phil alluded to this in Work Comp 101 talk, about when it comes to work comp premiums that employers pay, OSHA recordabilities go into the determination of that. So employers are very aware in most cases, and some are more acutely aware of it than others. Some absolutely want to avoid it, others it doesn't really matter. Some of that depends on their culture, some of it depends on how they are insured. But it's the bottom line for us going on site is that we need to know what that is. Medical treatment that's administered basically equates to a recordable injury. We'll talk a little, well, what's medical and what's not, because the other term is first aid. First aid treatment does not require that complaint or injury to be recordable. So it's what constitutes medical treatment, what constitutes first aid. And then talk a little bit about the importance of documentation of what to say, what not to say, because sometimes you do the same thing. If you term it one way, it becomes recordable, potentially other way it may not. And it's kind of a nuance with that. And certainly the communication with the employer, knowing what their policy is. Do they care about recordables? Do they not care? Because it makes a huge difference. We prefer them not to care about recordables because it is less restrictive of what we can do on site. So it comes down to medical treatment versus first aid. So medical treatment definition, management of care of patients to combat disease or disorders. In this case, we're talking about musculoskeletal disorders from our standpoint. But it's anything beyond first aid. We'll expand upon that. Medical treatment does not include a visit to a physician or a licensed health care provider, meaning us. It could be solely for observation or counseling. How would that apply to us? Patient comes to us and we can talk to them, educate them, talk to them about their injury, harm versus injury. So there's that counseling portion of it we can participate in, not being medical treatment. It would be considered first aid. Other diagnostic procedures, you can read that, x-rays, blood tests, so forth. And some prescription drugs do not necessarily include medical treatment. So what is first aid? Not that we're doing this, but it's good to know non-prescription medication at non-prescription strength, tetanus immunizations, cleaning, flushing, soaking wounds in the skin, wounds, Band-Aids, gauze, that sort of thing. And where we might be involved here, non-rigid means of support. Elastic bands, wraps, non-rigid, kinesio tape, for example. And technically anything that is not restrictive of the joint is considered first aid. So you define line, if you tape somebody's ankle up that doesn't move, that's restrictive. Things that don't restrict motion can be. So we may apply a kinesio tape. So you'll see there are things that we can do, which we might consider treatment, but actually would fall into that first aid category. Temporary immobilization devices, transporting the victim, okay, you can read those, would be first aid. Drilling a fingernail, not that we're going to do that. Removing splints, but this obviously is something that if they had an on-site medical department, they would be doing this. But also massage. Massage, strangely enough, is considered first aid. As we'll talk about in the documentation of it, don't call it soft tissue mobilization. That would imply that's a medical treatment. So when it talks about wordage, documentation, there's a good example. So already from a first aid standpoint, we can apply things like kinesio tape, we can administer massage. And another point is that OSHA considers treatment listed as first aid, regardless of the professional status of the person providing the treatment. So a physical therapist can perform massage, not be a medical treatment. A physical therapist can apply kinesio tape without being medical treatment. So treatments administered as precautionary measure to employee who does not exhibit signs or symptoms of injury or illness is not recordable. Previous discussion about stretching programs would be a classic example. They're not exhibiting symptoms. They don't have a diagnosed specific injury or illness, therefore it's not recordable. Injury or illness must exist to be recordable. So exercise recommended as part of a wellness to employees that do not exhibit signs or symptoms of an abnormal condition is not recordable, similar to the above. Okay. And then also non-work related injuries and administration of exercise is not recordable. So if someone comes in on a Monday morning and says flat out, hey, I was playing volleyball yesterday and I heard this or that, if we're on site, we can administer exercise, tell them They provide it in most states in Illinois and Iowa. We have direct access, so we can legally treat that person. But it's not considered to be a recordable injury. Now, if they come in and say, well, I did this at work, we can't do that. So again, knowing the situation, knowing and communicating with the employer is important. So in our instance, a written home exercise program where we're defining sets, reps, resistance, how often, constitutes medical treatment. So if someone comes in, you're on site, they have a complaint of a shoulder problem, and you say, okay, here, do this stretch, that exercise, 3 sets of 10 twice a day, that is medical treatment. Stretching to relieve symptoms, same thing, medical treatment. Mobilization, manipulation, medical treatment. Ultrasound. However, application of heat and cold is not recordable. So again, we can utilize that. We can utilize a massage. We can utilize taping. So there are things that we can administer without it being recordable. But you can kind of see the potential to cross over into that recordable category. So just a chart here, kind of summarizing from a medical treatment standpoint, supervised written home exercise program, stretching, mobilization, manipulation, medical treatment, unsupervised situations, massage, taping, heat, cold, first aid, things that we can do. And the other part of OSHA recordables that we have to be aware of too, and I think Larry alluded to this earlier when we were talking about job coaching with someone on the job, the restricted work recommendations impact recordability. So if an employee, if you keep an employee from performing one or more what they refer to as routine functions, so you immediately say, well, what does that mean? Again, gray area of that job or from working the full work day that they would otherwise have been scheduled becomes reportable. So we have to be cognizant of that so that we're not telling them, okay, when you're doing a job coaching, for instance, don't do that job or don't do that all day. That can be recordable. Healthcare provider recommends employee not perform one of the routine functions of their job full day, otherwise have been scheduled. It's the same thing. Okay. To me, that was supposed to be different, but sorry.
You were hammering home the point.
Okay. Be redundant. All right. So, bottom line is just being aware of making recommendations that might affect what they do. As Larry said, that is an employer decision. You can make recommendations to the employer, but don't verbalize that to the employee, because then you create problems. Documentation, things that you can say, things not to say in your documentation. It's better to use the word employee or worker as opposed to patient or client.
Some people use member. I know
Team member. Yeah,
team member.
you hear that.
I know Han uses member.
Okay. So your terms like preventative care, describe first aid interventions, educational components, job coaching, movement modifications. Those are terms that you use that would keep it in the non-recordable category. So the implication is that you're not treating an injury. The person's not a patient. You're not injured. And describe symptoms such as discomfort, stiffness, as opposed to injury or muscle tear, muscle strain, ligament strain, that type of terminology. Keep it vague for the body part. So on the other side of that, again, not using patient, not using the word treatment. home exercise program or documenting exercise program assigned to the employees based on the symptoms. We want to avoid, and certainly from a diagnostic ICD-10, they were not attaching any of that to what we're doing. Anything that would be clinical in nature that we might use in the clinic. Mobilization, manipulation, we don't want to use that terminology. So you keep it more, think first aid as opposed to treatment. Yeah, I guess the other one I've talked is soft tissue mobilization. I mentioned that before. Manual therapy, therapeutic exercise, terminology we use in the clinic, not so much on site.
I don't have a picture of a form, but I mean, we have basically what we're basically working on, and the form's going to be, I mean, I have a form that I use, and it's an Excel spreadsheet, basically, is what it is. And my form is, and it's nice because you can, obviously, if you're familiar with Excel, you can break it down into any number of things. But the long and the short of it, it's got the date that you saw them, their name. Let me continue.
Yeah.
Okay. It's got their name, the date. You know, I put in the workstation or the department that they're in. It may vary a little bit depending on if the employer has that. But how do you recognize where their job is at? Because it may change. You know, an employer may say, well, we're going to move them to a different department, and then you're talking, you know, you might recognize that it's at a different location. Then I indicate what service did I provide, and I'll put, is it job coaching, is it education, was it a PDA or job analysis, was it some type of first aid, and so all those little things that we talked about, I put in there. And I'll have a category for those. What service did I provide? Just a brief thing, okay? Just a brief thing. And then an area of comment where you can elaborate. But you also want to put in there, did you just follow up with the employee, or did you share, if you recognize that somebody was having symptoms, or it needed to be addressed? Maybe you talk about that safety interaction. I did the job coaching, but I think there needs to be some job modification. You know, did I follow up with the supervisor or the health safety department? So you're basically saying, did I follow up with that? But so it's just, you know, a comment section is probably where you're going to elaborate a lot, but mostly, but you just, you know, basically very simple. There's been all sorts of forms we used. Greg and I found a system that really worked nice. That was by, who did it? Matheson
Yeah.
did it, and it was computerized. I brought an iPad with me, and it was slick. Unfortunately,
Apparently we were the only ones
we were the ones using
discontinued it.
so they discontinued it. Yeah. So, but it was a nice, slick system. So, so that form will be, you know, we kind of. The form will be in the share drive under this, but if it's a company that it's a little different, we may, it doesn't have a department or a workstation. They just have a job title. I know places like Hahn will have, their employees are called work cell operators, okay? And that's a real general term, but they put it that way, work cell operator, just because if they move to a different department, and it's still work cell operator, it goes into this, well, we're still classified, we're not changing their job. They're still a work cell operator, they're just doing a different task. And so they're still qualified underneath that. So they may fall under that category. But anyways, the documentation is we'll tailor that a little bit, but in general, I think I find that an Excel document that lists that out keeps you from doing way too much, and it just can continue to follow on a day-to-day basis and make it brief, and it shouldn't take you much more than, unless you're me, it doesn't take more than 2 minutes to fill out.
So yeah, we have a good question here. It has to do with a question about job rotation, which is a great strategy in a lot of places that have high repetition. So it makes sense from a stress reduction strategy to rotate them out of that to a job that is not stressing the same thing. Unfortunately, what you see a lot is they go to a different job, but they're doing essentially the same thing. But the question here would be, an employer has a job rotation that's already in place, and if that person you're working with, I'm presuming here, is not currently rotating jobs, can the job rotation schedule, be recommended to follow that? Certainly, it makes sense to do that, and it's good to know that they have job rotation. And so then you get into if there's rotation in place and they're not doing it, why aren't they doing it? So it's the whole communication, investigating, well, why are they not doing it if they're supposed to? But certainly that it's a great strategy as long as you know that they're being rotated to an area that's not working the same body part the same as the previous job. So, but yes, that's a great, and you come across that quite frequently.
Yeah, one of the situations I came in with, again, with Han, is that, they're building chairs. So they have three build department parts of it. They build three portions of that, and then they have a pack out where they put it in the box and stuff. And so they had one person that had chronic problems with their shoulder, and so it was supposed to be a 4-person rotation. That person with that chronic shoulder problem, she said, hey, I just really like to do pack on them, and I don't want to do any of those others. So they say, well, she's not complaining. She's not the squeaky wheel. She'll put her there. She's fine. So unfortunately so the pack out was much less of an assembly part and was part of the rotation that got taken out. So now you have 3 other people that are having complications because they're not rotating it into that pack out department. It was less stressful. So you get those situations.
Well, and that's where you get into we talked earlier about the different stakeholders, manager, supervisors. Production is often they're graded on, and so production oftentimes take precedence over things like job rotation. The product's still got to get out, and oftentimes it can lead to problems. So it's difficult to navigate that oftentimes, and you may or may not have any control over it, but it's a great recommendation. Okay, so just a couple other things here. Can we talk about this?
We haven't yet.
Do you want to?
Oh, okay.
Okay,
Yeah.
go ahead.
So when we talked about the job analysis, the many names of a PDA job analysis, risk assessment, we have several different tools that we use. Okay, and if you're fortunate to be able to have a big company that you're going on to, you'll definitely handle this fairly regularly. Like Case New Holland, and so you got a toolkit, a force gauge kit. You got a scale. It's just a different scale that I got it. So that's the force gauge, and it measures both push and pull. You'll hear patients say, well, I have to lift 1,000 pounds a day. Well, they're not really lifting 1,000 pounds. It's pushing and pulling, and if it's got good wheels, it may be 20 pounds of force to move or 40 pounds in force to move, so you really have to measure that. There's tipping points and different things like that you can measure. There's what Greg is circling now is the push, the things you hook up to there to measure the push. And then there's a collect hook, I think is what it's called, that you hook up to it, and some ropes and cables that you can do to push carts, pull carts, things on tables. So you get to measure those things. We use our phone to videotape one cycle of the job. So when you're doing a PA, we talk about looking at the cycle of the job, videotape that. Some employers don't want it. A place like Harbor Pump, they provide stuff for the Navy. They make parts, pumps, and stuff for the Navy. So they don't let you bring your phone in. But once they build you up, you're comfortable with that, then they'll let you, they'll find ways to help you. And it just, for me, the video helps when they do that because you can watch it over and over. I don't always see it everything in an hour, so you got to watch it a little bit. Stopwatches and calculators, and I think tape measure, I think was not on there, but the tape measure is good that we want. So those are kind of, it's just the kit that we're going to be using, and for when you go on site and do a lot of different things and, to measure that.
Okay. All right, the last thing.
Second one.
Oh, second to last?
Yeah, Ken wants me to comment on one thing too.
Oh, okay.
So
All right.
you can keep the circles in it. Just
Okay.
make it smile.
Yeah, I guess that-
Make it smile.
Just wanted to make a mention on some of the arrangements that might exist with the employers in terms of these services. It's all over the place. From if we're talking with an employer that wants to have on-site services, generally speaking, what we're going to talk to them about is what scope of service, identifying certainly what it is they want. We made several comments before about knowing what it is they want, not necessarily what they call it, so that so that we can be accurate and on the same page in terms of what service are we providing. And that's spelled out and everybody knows what that means. Typically, it's an hourly rate that we're going to quote with them. And what we find is that what works best is to say, okay, we'll come out, if you want us to look at a job, we're going to quote an hourly rate, but typically it's the first visit, the first 2 hours are going to be billed at that hourly rate. So if we go out and it takes just an hour to do, we're probably going to bill them a couple of hours to account for some of the inefficiency of us leaving the clinic, coming back to the clinic, coming out of patient care, that sort of thing. So for example, we have a contract now with an employer that the first 2 hours, anything up to first 2 hours, we're going to bill 2 hours. So if we're there for 20 minutes or 30 minutes, an hour, it's going to be 2 hours, and then on an hourly basis after that. And that's just, what we try to accomplish. So there are a minimum number of hours that are going to be paid. So, and they don't typically have a problem with that. Mentioned also about the issue of work comp versus non-work comp when we're on site. Again, it's knowing the situation and what the billing implications of that means. So you may go on site and you're asked to work with an injured worker that is a recordable injury, it's a work comp case. Having an agreement and understanding with the employers, how do they want that to be billed? Because if it's a work comp case, they've had other medical treatment, what we do with them on site will be medical. And are we billing the employer at the hourly rate we may have agreed with them, or are we billing the work comp insurance? So knowing that is really important. So again, it's that communicating. So I just wanted to throw that out there in terms of knowing what the score is. Oftentimes, if they ask, for example, to do a job analysis, it's knowing why do you want the job analysis? Is it just for the purpose of their records, or they want to use it for other things, and it's not attached to a particular person, and that's more likely going to be the hourly rate. Whereas if they have an injured worker, you're doing a job analysis, clarifying, are we billing the work comp carrier for this, or are we billing the employer? So I just want to throw that in there. So that is all we have.
Ken wanted me to kind of, add just the final thing, I guess, is, I've been asked to kind of take more of a primary role in the training and on-site. Greg's got, just as much, if more knowledge than I did, but he's got a lot on his plate too. And so coming up with kind of a training outline, a training program. What does that look like? And it's going to vary a little bit from time to time, but we've I've looked at it and say, we can probably get majority of what people need to know, and not going to be experts, but need to know in 8 weeks, and to just kind of help mentor them along with that. And we want to, and so what that means is, what does it look like to navigate the plant and to do job coaching, and what is the terminology we use, and how to do a job analysis and a risk assessment. So some of these things that we hit on this, and so we should be able to hit some of the basic things and have you a general good understanding in about 8 weeks. So really week 1 is about navigating the facility and just getting comfortable with the facility, and whether you do that once a week or twice a week. Talking a little bit about what does job coaching look like, education, and just having some employee interaction. We don't have to plan on doing a PDA, but we just want you to get comfortable, communicating with the employees, looking at the jobs, familiar with yourself with the plant. So that's really week 1, week 2, and what we get comfortable with doing that. Okay. Some plants are bigger than others. And so it just takes a while, and you're going to get lost at times, and then and just observing the jobs. Carrying over to week 2, again, we're still going to do that job coaching, that education, employee interaction, navigate through the plant. We're going to continue to do that every week as part of that. We'll sit down with you and what Greg talked about with, the OSHA and the documentation and the terminology. We're going to dig into a little bit that, take an hour or so of our time and say, let's really answer some of these questions, and what does that look like, and continue to talk about that a little and more in depth. And then how does it apply to that employer that you're at now? What are they going to, and who are the safety people, and where are they located in the plant? And we will do that in week 1 as well. So, if you need something, where do you have to go? And then weeks 3 through 8, it's really, I'm going to be on site, and if like with Case New Hollands, right now, where they want us to do job analysis, PDAs. They want us to do as many as we can. If we can do a job in every plant. So our goal is, can we knock out and do as much as we can? And so I'm going to be doing a lot of those as much as I can, because I can do several, but we're going to have you observe me doing it, assist me in doing a full PDA. So what, after we do a couple, what does that look like in its entirety? And then each week, I'm going to ask you as a therapist is to do a portion of that job analysis. Week 1, week 3, it's going to be just identifying the employee, the workstation, the purpose of the job, and you're going to do that on 2 or 3 different jobs. You're just going to identify that portion of it, and then each one of the weeks thereafter, you're going to identify a different portion, from videotaping the job and identifying the essential functions of the job, to identifying the tools and the sensory requirements, to material handling and how do you measure things, measure how much something weighs or push or pulls, how much something measures in distances and inches, and finally just any other requirements. So you're getting exposed to each component of that, as well as what it looks like at the end product. So we're not going to try to overwhelm you with doing a full job analysis day 1. Okay, you've done 3, you're on your own. We're going to get you comfortable with that, but we will complete full ones together. But I'll ask each one of you to try to do a portion of that during that 8 weeks. So it's going to vary. It's going to vary based on what the employer allows us to be there once a week, twice a week. But this is kind of a snapshot of kind of the 8-week program that we're going to look at, is see if we can introduce. And then there's, after that 8 weeks, there's going to be follow-ups. It's going to be, I'll be there once a week or once a month or once every couple weeks. And really, it just depends on the need and how comfortable you get. Okay. The situations are a little different, and like with Bill and Pio or in Goodfield, right now you're not going to be doing any on-site physical therapy care, so that's not going to take as much time from you. Where Matt in Burlington, he's doing 3 times a week. He's on-site doing care, so that makes it a little more challenge for him to designate a full day, 3 hours, 4 hours to doing some of these other things. So we're gonna, there are gonna be some challenges, but we're gonna work through it. So Bill's might flow through pretty easy in 8 weeks, and Matt, yours might take a little bit longer. It's just gonna be on the time frame, but we do need to allocate time to that, and we'll help you as much as we can. So that's generally what that's gonna look like. Okay.
Yeah, thanks, Larry. So this is Ken. I just want to kind of wrap things up here. Again, thank you all for joining us for the presentation today. And Greg, Larry, thanks for preparing this. Again, just kind of as an overview, really, these two, the webinar today as well as last week, is really to give that framework and overview to on-site services. And then I appreciate, Larry, you sharing the kind of what's next. Should we have an opportunity with a new company to come on site and you were to provide the services, being that there's a lot to know clearly, and just using a mentor training program, as Larry mentioned, where he will be on site with you for a period of 8+ weeks. How he's designed this out, I think, is really the next step of making sure you have the right experience and you get the repetitions you need, and he's right alongside to make sure that that quality of service is there, and you get the training that you feel you need to to carry that out properly. So just wanted to share what the next step was. Should you be providing services on site? Lastly, I do want to share again, this presentation will be recorded, or it is recorded, and we will send both links out from last week and this week all together. But I do want to mention too that if you're still on your screen here, if you were to go onto the shared drive, the work comp management file, and then on-site services is where you'll find today's presentation. So if you need to reference or like to reference anything of today's session, feel free to do that. So anything else, guys, for today? So. All right, we'll let you go a little early, but again, thank you very much for taking the time to be in today's training, and we look forward to growing our employer services in your areas, and hopefully we're on site soon enough. So thanks a lot.
Thank you.